Hello my fellow med students, PA students, nursing students, and alien invaders currently watching this video and planning their descent onto an unexpected planet. My name is Sebastian with Dr. Images MD, and this is the Battle of the Brachial Plexus. Now there's no way around knowing the basic setup of the brachial plexus, so let's get started with that. From left to right, it goes roots, trunks, divisions, cords, and then branches. I use the mnemonic Randy Travis drinks cold beer. Not sure if this is patented. If so, and you're the person who owns it, please don't sue me, as you'll quickly find out I'm worth large negative amounts of money. Now let's go over these really quickly. The brachial plexus includes innervations from the roots C5, C6, C7, C8, and T1, along with a few bits of connection from C4 and T2 that we're going to ignore for this video. The plexus is laid out as we see in this drawing, with C5 and 6 connecting, C7 remaining alone, and C8 and T1 connecting. C5 and 6 form the upper trunk, C7 forms the middle trunk, and C8 and T1 form the lower trunk. Next come the divisions, which I will add on here. All three posterior divisions form the, you guessed it, the posterior trunk. The upper trunk and the middle trunk's anterior division form the lateral cord. The lateral trunk's anterior division forms the medial cord. Now, unlike the trunk's names, these don't make as much sense at first glance. That's because we're working on a 2D image. In 3D, represented here by these pens, the cords now surround the artery, which, depending on where you are anatomically, is either the subclavian or the axillary artery. The posterior pen, in pink, is posterior to it. The lateral, light orange, is more laterally located, and the medial, minty green, is more medially located. So now I reach the part we really care about, the branches. The posterior cord splits into two branches, the axillary branch and the radial branch, which we will soon come back to later. The lateral cord forms the musculocutaneal branch, the medial cord forms the ulnar branch, and the lateral and medial cords join together to form the median branch. This is a prominent M shape that is often referred to. A mnemonic for these is MARMU, M-A-R-M-U, musculocutaneous, axial, radial, median, ulnar. So now let's talk axial. The axial is represented by this large axe that our battle champion is carrying. You'll notice that he's wearing a shoulder guard that's colored green and red. For the remainder of this video, green is muscular innervation and red is sensory innervation. The axial nerve supplies muscular innervation to the deltoid and the teres minor. This is a lowercase t holding onto the shoulder pad. It also supplies sensory innervation to the lateral portion of the proximal arm, or the side of the shoulder. The damaged axial nerve results in a flat deltoid with the inability to abduct the arm past that what the supraspinatus can handle, 10 to 15 degrees or so. Now the teres minor is a rotator cuff, or sits muscle, S-I-T-S, and does lateral rotation of the arm. The axial nerve damage also causes sensory loss in the portion of the deltoid. Lastly, the axial nerve is C5, C6. Now let's see the other side of our champion, the radial nerve. The radial nerve is C5 to T1, and it controls the extensors of the elbow, the extensors of the radial wrist, and the odd brachioradialis, which is a posterior compartment muscle that is a weak flexor of the elbow. Now these muscles are represented by three round shields. The X for the extensors, the snake for the anconeus, and the broken shield for the brachioradialis. Three shields also represent the triceps brachii. Now the radial nerve courses through the radial groove around the posterior aspect of the humerus with a deep brachial artery, then crosses the lateral aspect of the elbow. Here it innervates the supinator to spill soup onto this slave the champion has captured. This slave, or intern, also has some impressive inferior gluteal innervations. That is to say, he has a large butt. He is the posterior interosseous nerve, formed from the radial's deep branch as it passes the supinator at the elbow. The posterior interosseous controls extension of the rest of the wrist, and the posterior compartment extensors of the digits as well. Of special note, it is an extensor and abductor of the pollicis, or first digit, or thumb. It is C7 and C8. The radial split also gives rise to the superficial branch that will give sensory innervation, the red seen here on the intern, to the lateral half of the dorsum of the hand, excluding the digits 1 and 2 from somewhere between the MCP and the PIP on up. Basically, the back of the thumb and a lateral hand itself. The intern has crutches to remind us of Saturday night palsy, where crutches, or sleeping with an arm over an armrest, can cause radial nerve damage seen as wrist drop and extension loss of the elbow on down. This brings us to the musculocutaneous, C5, C6, and C7. The adorable soldier is some sort of Rambo Girl Scout mix with their jacked up biceps brachii and harmless ponytails. The musculocutaneous nerve controls flexion of the biceps brachii, brachialis, and coracobrachialis. all the real elbow flexors, with supination and also some arm flexion of the shoulder as well. This nerve gives off muscular innervation as it dives into the coracobrachialis through the biceps brachiae and then turns sensory innervation from the elbow on down as a lateral cutaneous nerve of the forearm, hence this extra ponytail oddly coming off her forearm. Below that is the median nerve, C5 to T1. I will ignore the median nerve before the elbow, where it crosses on the anterior aspect of the elbow, where it arises from the cubital fossa to dive between the heads of the pronator teres. It supplies all the anterior forearm compartment muscles except the 1.5 muscles the ulnar supplies, which we'll mention in a few moments. This allows the median to control wrist flexion and flexion of digits 1 through 3. We represent this with the Pope battling this angry gorilla, who clearly disagrees with the Pope's new stance on carpooling to work. What? Oh yeah, the median nerve is the nerve that classically is compressed in carpal tunnel syndrome. So let's add the sign. In the hand, the median nerve gives sensory input to the lateral palm in the digits 1, 2, 3, and half of 4, as seen on the ape's hand in red. To drive this home, we can also see it here. Now there are 5 pieces of lumbar to represent the 5 digits. The cardinal here is seen cutting the first, the second, and the third piece of lumbar. You can also notice that the 4th piece of lumbar is split in half. This is to represent the fact that the median nerve controls the sensory input to 1, 2, 3, and half of the 4th or ring finger. The lumbar actually represents the lumbricals, the first 2 of which are muscularly innervated by the median nerve. The thumb lumbar is added just to allow us to see what side is the lateral and the medial side of the hand. So damage to the median nerve can be proximal, causing the classic Pope's hand, Pope's blessing, or hand of Benedict. This occurs when you attempt to make a fist due to the loss of the median nerve flexors. Distal median nerve damage causes median claw. This occurs at rest or when you attempt to extend the fingers. The radial extensors allow most extension to occur. However, the loss of the median nerve's muscular innervation to the lumbricals of digits 2 and 3 leave these 2 digits partially flexed the PIP and DIP joints and hyperextended the MCP joints, as the lumbricals are required for flexion, or in this case avoiding hyperextension at the MCP, and are required for extension at the PIP and DIP. This is the opposite of the ulnar claw, seen after distal ulnar nerve damage, here on Olga of the ulnar mountains. On her right hand, you'll notice this. You'll notice that it superficially looks like the Pope's hand. However, the claws show hyperextended MCP joints and are occurring when the hand is being extended or is at rest. Pope hand occurs when you attempt to flex the hand into a fist. Ulnar claw is due to the ulnar nerve's muscular innervation of lumbricals of digits 4 and 5. Though before we continue talking about Olga, let's finish the median nerve and the great ape here. The great ape is showing ape hand, median nerve damage resulting in loss of thumb abduction and opponent's loss, leaving the adducted, adducted, and non-opposable thumb, which has caused this great ape to drop his spear. Interestingly, this is a misnomer of a name, as your lesser apes, great apes, and old world monkeys, like baboons, all have opposable thumbs. That's right, you may one day see a patient with an ape hand deformity, but Caesar himself is just one Alzheimer's treatment away from destroying humanity. Let's get back to Olga and her C7, C8, and T1 control of many intrinsic hand muscles. Olga is carrying a hand and a half sword to signify her control of 1.5 forearm anterior component flexors, the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. This control causes the OK hand, seen in the proximal ulnar nerve damage. Olga would have attempted to make a fist, like her left hand seen here, and her digits 4 and 5 would be unable to flex. Distal ulnar nerve damage, on the other hand, get it? The other hand? I'm really clever. Distal ulnar nerve damage shows the ulnar claw. Olga, the big powerful woman she is, doesn't have time to seduce a mate. Instead, she chooses to catch one in the tunnel of guys. This stands for the tunnel of Guyot, where the ulnar nerve passes through the wrist after traveling by the medial condyle of the elbow and through the forearm. The tunnel of Guyot isn't producing well today, so Olga has increased her chance of success with a mate by putting this piece of ham on a fishing hook. This represents the fact the hook of hamate is another commonly damaged area for the ulnar nerve. Lastly, the ulnar nerve controls sensory input of the medial half of the dorsum of the hand, including the medial half of digits 4 and all of digit 5, and the sensory input of the medial palmar hand and half of digit 4 and all of digit 5. Okay, this is likely the most important of all of them to know, the long thoracic. Tall thor, seen here, is coming off C5, C6, and C7. The muscular innervation of the serratus anterior occurs through the long thoracic. Damage to it is common from a stab wound or axillary node dissection, commonly following mastectomy. Hence, tall Thor's proud support of breast cancer on his shield. You'll notice Thor's arm is above 90 degrees, which shows the rotation of the scapula the serratus anterior has allowed to occur for this abduction above 90 degrees to occur. Next, off the upper trunk is the suprascapular nerve. These two soldiers are fighting during spin class. The right soldier represents the supraspinatus, which initiates abduction, and the infraspinatus is the left soldier, which takes place with lateral rotation. This is S and I of sits, part of your rotator cuff muscles. Now each is doing their respective motion as the battle in spin class continues. Now below them, as seen here, the laziest of all my drawings today, is the dog's head. This is the subclavian nerve, or the nerve of the subclavius. The collar represents the collarbone's nearby muscle, represented as this dog's collar. Who needs a body anyway? Onward to the lateral and median cords, where these two birds are battling over a small and a long worm. Larger bird is the pectoralis major, and the smaller, yep, you guessed it, the pectoralis minor. You guys are getting good. The big bird already got the small worm off the lateral cord, and now is fighting with the small bird of the bigger worm that comes off the medial cord. So the medial pectoral nerve supplies the minor and the major, and the lateral pectoral nerve, yep, just the major. Now to the posterior cord, where the battle has moved under the sea. Two submarines are battling. The first, the upper, is the upper subscapular nerve and is coming first off of the posterior cord. The lower is the lower subscapular nerve and is the last one to come off this posterior cord. Both innervate the subscapularis, the last rotator cuff muscle of the day, and if you look closely at the periscope of the lower submarine, you'll see the uppercase T, standing for the teres minor. Now, if the world was fair and just and anatomy was easy, the nerve between the upper and lower subscapular would be called the middle subscapular. But alas, that is just its alternative name. The real name of this nerve, represented by the sharks the subs are battling with, is the thoracodorsal nerve, seen here by this shark and his green shark fin. Now this shark is actually the god Thor, with 50 teeth of undersea anger, and a lightning superpower that seems horribly dangerous in the current scenario. The thoracodorsal is the muscular innervation to latissimus dorsi. Now back to the root of C5, giving off this nerve. The dorsal scapular nerve, seen here with the shark wearing a baseball cap. He doesn't want to fight, but just ride his rhombus-shaped elevator back down into the ocean. Muscular innervation to the levator scapulae and the rhomboids. Now the final nerve of the brachial plexus today is sensory. Off the medial cord comes the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm, sometimes called the brachial or antebrachial nerves of the arm and forearm. Each is sensory innervation for the portions seen here, with the medial cutaneous nerve zone of coverage technically surrounding that of the intercostal brachial, ignored for simplicity in this image, so please check that out. The poor guy has lost his arm fighting for this drawing. Now let's add one more nerve. Seen here is this boy standing on a trapezoid holding his number 11 balloon. He's watching this archer kill another soldier. That's right, he's an accessory to murder. Cranial nerve 11, the spinal accessory nerve, and the trapezius is the muscle innervated. Hope you enjoyed the Battle of the Brachial Plexus. I'm Sebastian with Dr. Images MD. Subscribe to my channel and come back and see us for more videos. As always, have a productive day. You can also notice the fourth piece of lumbar is split. You can also notice that the fourth piece of, you can also notice that the fourth piece two submarines battle. The upper, the subclavian. It's not correct. The real name of this nerve, represented by this shark the subs are battling with, is the thoracodorsal nerve. The real name of this nerve, represented by the sharks the